David Holt, the mayor of Oklahoma City, and as the co-chair of the Reimagining Public Safety Task Force here at the National League of Cities, I'm excited to welcome you to our first listening session. This one is called City Leadership in Transforming Responses to Calls for Service and Violence. Before we get started, I want to let everyone know that the chat is a good place to ask questions. You know this, you have used these platforms before, but that's a great place to leave comments or share resources throughout this conversation. Our moderators will be keeping an eye on the chat and addressing as many questions as they can throughout this program. For those of you who may not be aware, on January 27th, we launched NLC's Reimagining Public Safety Task Force, made up of over 20 local elected officials committed to rethinking their local public safety systems. Over the next 8 months or so, the task force will be coming together to think critically about several justice and public safety related issues and create a toolkit outlining a menu of options for cities that align with promising policy and practice that local leaders can build on. Through listening sessions like the one planned for today, we hope to dig deeper on specific topics and through the testimonies of some of our task force members. In partnership with experts, we hope that our task force and those of you joining us begin to collectively think about public safety in holistic ways and determine what is best for your residents and your city. We will be sharing our future listening sessions soon, and we'll keep you engaged and up to date on our work and our progress. My co-chair, Newark's Mayor Ras Baraka, will now give some additional insight as to today's specific topic. Mayor Baraka.
Thank you, Mayor Holt, and welcome attendees. I also want to take this time to thank the team at National League of Cities, the MacArthur Foundation, and our various partners in this work. Today, we get to discuss a topic that has been of interest to many of us as we think about the public safety response since the murder of George Floyd. And in many cases before that, the idea that police officers and traditional law enforcement response is not always the most effective way to deal with crisis or violence. And that has been on the minds of so many local leaders and residents alike. Additionally, some of the cities are seeing very high spikes in violent crime despite generally low crime rates nationally, and an issue that always requires transformative approaches. And it's important to note that while people tend to immediately think about big cities and guns when it comes to violence, domestic violence, child abuse, and other forms of violence also part of this trajectory. While emerging much before 2020, these promising alternatives have been more evident over the last 6 months or so. Today, we get an opportunity to touch on two major areas of these reforms. First, we will hear about alternative responses to calls for law enforcement as it relates to mental health, substance use, homelessness, and other nonviolent situations. Through co-responder models and community responder models, cities are truly at the forefront of initiatives to lessen police presence in situations that can be better addressed and even de-escalated by other trained personnel and professionals. Later, we will dig deeper into some alternative methods to dealing with violence in cities through initiatives like violence interruption and the creation of offices of violence prevention and neighborhood safety like we have in Newark that really get at the trauma of violence and look to utilize the closest to the problem to serve as gatekeepers, the people closest to the problem to serve as gatekeepers to the solution, something that we have prioritized here. I want to recognize the work of the Vera Institute of Justice and Cities United and thank them for guiding these conversations today. Additionally, I'd like to recognize our task force members that are serving as today's panelists. Council members Monica Rodriguez of Los Angeles, Jamie Gauthier of Philadelphia, and Lanice Lewis George of Washington, D.C. Mayor John Engen of Missoula, and Council President Nikki Fortunato Bass of Oakland. Again, Mayor Holt and I are excited to lead this important group and welcome everyone to today's session. I'm going to now hand it over to Daniela Gilbert of the Vera Institute of Justice to guide the first part of today's conversation. I know it will be robust and impactful. Thank you.
Hi, everyone. So glad to be having a discussion with Council Member Jamie Gauthier and Council Member Rodriguez and Missoula Mayor John Engen as well. Is John here as well? maybe not yet, but we'll get started without him. So we're here with a recognition that we over-rely on law enforcement to deliver public safety, and with a recognition that our current investments and systems are inadequate in producing public safety. We overinvest in systems of oppression and underinvest in systems of opportunity. Vera's arrest trends analysis shows that every year there are over 10.5 million arrests, which is one arrest every 3 seconds. 5% of those arrests are for violent crime, and 80% are for non-serious and low-level offenses linked to poverty, homelessness, and mental health challenges. With more than 240 million 911 calls made each year, a sizable portion of police officers' time consists of responding to these calls for service. It's worth noting that the Substance Abuse and Mental Health Services Administration National Guidelines for Behavioral Health Crisis Care state that it's unacceptable and unsafe for police to serve as the de facto mental health mobile crisis system, and that the mere presence of police vehicles and armed officers during these calls can often escalate the situation. So we're here today to learn more about local efforts to send more appropriate resources to respond to crises. Hi, Mayor Engen, thanks for joining us.
Thank you. Apologize for my technical ineptness.
Oh, no problem. We're just getting started. And so today we're here to learn more about your local efforts. And I'm going to share a little bit of information about the models in each of your cities, and then we'll launch into a discussion. And if folks have questions, please share them in the chat, as Mayor Holt mentioned, and we'll do our best to weave them into the conversation. So about 2 years ago, Philadelphia launched a pilot of a co-responder team of behavioral health professional and a police officer, and in October launched a program to embed clinical staff alongside dispatchers to determine the most appropriate response for 911 behavioral health calls and expand co-response. And this month, it was announced that Philadelphia will also launch alternative response teams of a clinician, an EMT, and a certified peer specialist. In Los Angeles, in June of last year, the City Council unanimously passed a motion in support of setting up a non-police response program, and these teams will respond to calls related to mental health, substance abuse, suicide threats, behavioral distress, conflict resolution, and welfare checks. This month, Los Angeles also launched co-responder units to serve as primary response to 911 calls rather than relying on co-responders as a secondary response after patrol has been dispatched.
You actually went to
In Missoula, Mayor Engen proposed mobile crisis response teams in June to respond to 911 calls, and in November, mobile support teams of an EMT, a licensed social worker began being assigned by 911 dispatch to behavioral health calls as an additional unit to accompany the normal complement of emergency first responders. So that's an overall summary, and I first want to ask if anyone would like to add anything to that high-level description of what's being implemented in your communities before we launch into the discussion. Okay, great. So, you know, to get down to brass tacks, I'd love to actually begin with asking you each to share some information about the costs of programs and how they're being funded, so folks have that in mind as we discuss potential models. We'll start with you, Mayor Engen.
Great question. It always is brass tacks, right? Funding. We're using a grant. It's a state and tribal matching grant through the state of Montana of about $350,000 that funded a 10-month pilot. Behind that, we've committed to continued funding for this program, and frankly, I think expansion of the program. The pilot is proving to be highly effective. We're taking really good care of people. We're giving peace officers a little bit of relief, and our response is appropriate to the nature of the call. Our hope is that, again, we can expand this program even further. In addition, over the years, we've been sort of nipping at the edges of mental health crises. Our downtown police officers assigned to a specific beat have had a social work student attached to them, and again, sort of responding, meeting people where they are at the right time, at the right place. But there's more of this work to be done. And the fact of the matter is that we need both, right? We need peace officers and law enforcement response, and we need mental health response, and they're not mutually exclusive. And this isn't a zero-sum proposition. You don't defund police and fund the mental health response. You work to collaborate and ensure that you're using your resources as best you can to serve your community.
Thank you. Councilmember Gautier, do you want to share a little bit about cost and funding?
I actually would need more information to give you the exact cost.
Okay.
I know that the funding is a mixture of what we already kind of have in the city coffers, and we're also grant funded to support this programming as well. I'm sorry, but I will get that information for you.
That's fine. And Councilmember Rodriguez?
Yeah, thank you. Because we didn't have, we were ready for that question on the specific cost of that. But I will say, you know, like my other colleagues, when we were talking, for example, with this therapeutic van model, we have been in negotiation with LA County, which in the city of Los Angeles, we are one of 88 counties in the county of Los Angeles. And so working with them, we had secured some of the initial investments where they would disproportionately cover the costs associated with providing the staffing of those mental health professionals that would be assigned to the therapeutic mental health vans. Now, the city of Los Angeles, our cost associated with that would be incurred by the co-location of these vans and this staffing at our local firehouses, which we have identified 5 to pilot. In addition to that, we're also talking about roughly a $2 million cost associated from our revenue versus what the county is investing in that. Now, we are still, full transparency, still in negotiations and inking that deal because we are constantly in negotiations with the county over the services that they're required to provide versus what the city should be doing. And the same holds true when we have conversations about homelessness and a variety of other areas. But just to dovetail back to where some of the initial investments come from, like many of you, we're always struggling with meeting the day-to-day needs. And when you're shifting priorities to invest in new models, you have to always look for some of those alternative funding methods and those one-time funding sources to get the ball rolling. And so when it came to the APRUs, for example, which were our co-responder models that assigned, for example, a nurse practitioner with LA City Fire Department in response to what historically has been, listen, we don't always have to take you to an emergency room, but how do we address in a fast triage a response with a nurse practitioner so that we can reduce our call load and our burden to our engine company, for example, and a rescue ambulance. These alternative models were first funded as a pilot with Innovation Fund dollars, which is a fund that the city allocates each and every year to help identify new methods for us to deploy these types of new ways of servicing our city in response. So we always try to find initially some either grant funding or some one-time special funds so that we can develop the model and test it before we fully fund it. Because like many of you, you got to make sure that it works, and how we migrate a lot of what the systems have already been structured in place so that we can offload it later and kind of figure out how we align those resources better. So, but I'm happy to get you more of the specific dollars associated for everybody in terms of how we break out the costs between the city and the county and whatever other resources that we have to help support these alternative models.
I wanted to come back and answer that question if I could. Okay. So Philadelphia is putting into place 4 co-responder teams with crisis intervention trained officers and clinicians and 2 peer specialist teams. And that's a partnership between the Philadelphia Police Department and our Department of Behavioral Health and Intellectual Disability Services. So those pilots will cost about $942,000. It's being paid for through a mix of city funding and also some funding from a grant from the MacArthur Foundation. that that budget number only includes the cost on the behavioral services side. There are also costs to PPD that includes the CIT training, for example, but those costs are already sort of embedded in the PPD budget.
Thanks so much, Councilmember, and thank you each. It sounds like there's combinations of one-time funding opportunities that you've pursued, leveraging other local partners and commitments, and leveraging existing commitments as well. And there certainly isn't a one-size-fits-all, but it does sound like identifying funding resources to reallocate or develop specifically for the pilots has been helpful. I'm wondering, Councilmember Gautier, if you could share a little bit about maybe how the initial co-responder pilot inform the new expansion and triage, and if there's any learnings from that expansion process or any early results that you're able to share.
Sure. I'll also sort of give you, is it okay to provide you with some local context as well?
I think everyone appreciates context.
Okay. So the need for these types of alternative response and mental health responses played out in a very real way here in Philadelphia. On October 26th of last year, a 27-year-old Black man named Walter Wallace Jr. was having a mental health crisis. His family called for help. Police arrived at the scene, and within 41 seconds, he was shot dead in the street in front of his mother and all of his neighbors. This was a household that was known to PPD. They had responded many times for other mental health episodes, and in fact, the police had responded several times on that same day. But in this particular moment, armed officers responded by themselves, and the result was the murder, the shooting of this young man. And also the city erupted in civil unrest once again, in West Philadelphia in particular. One of the heartbreaking things about what happened with Walter Wallace Jr. is that the city had already begun working on its co-responder model just a couple of weeks before. So prior to October 26th, the city had taken the first step to begin building out its 911 triage and co-responder program, which is designed to connect residents experiencing behavioral health crises to the support that they need. Through the pilot, the city embedded a behavioral health specialist from the Department of Behavioral Health into the police radio room for the first time in the city's history. The intent was that when behavioral health crises calls come in to dispatch from police radio, the embedded clinical staff would work alongside dispatchers to determine the most appropriate response for the calls. The pilot only included one mental health professional embedded in the 911 call center, and that person was not working at the time when the call for help came in from the Wallace resident. And so following the Walter Wallace Jr. incident, the urgency around this issue has been kind of raised, right? And Philadelphia has been moving forward faster as a city to develop a more robust mental health response. At this point, we still have the clinician in the call room. They are working to try to understand what calls come in on a daily basis. And as operations scale up, that person's duty will shift. PPD is trying to figure out how to separate calls into different buckets so they can get the calls directed to the entities that would be most effective with dealing with them. They've also developed new scripts for calls that come into 911. So when new efforts are ultimately in place, all calls to 911 will be asked certain questions to ascertain whether or not this is connected to a mental health crisis. And as a result of these efforts, more calls are being directed to CIT officers in the field than ever before. So we're still in the early stages of our pilot. And I don't have, we didn't have a lot of data ready to share today about what we've learned, but I do know now that we're moving forward, we've moved forward with the script. We're training not only officers in CIT, but we're also training people in the call room, in dispatchers, and we're working on the various co-responder and peer specialist teams.
Thanks very much. Councilmember Rodriguez, I was hoping you could share a little bit about how the different response programs and options in Los Angeles interface with one another, given their various duration and history.
Sure, thank you, Daniela. And you did such an outstanding job of, I think, introducing and comprehensively covering all the different alternative models that we had in the city that I thought, well, that's everything I was going to talk about. But just to kind of restate it, we, prior to the incidents of last, the occurrences of last summer, we had already been deploying a number of co-responder models, as you had indicated, with, as I mentioned, the Advanced Provider Response Units, which we call the APRUs, which assign a nurse practitioner to our fire department stations for those deployments. DART, which is our domestic abuse response team, as well as our mental evaluation unit that was, again, a co-response model with LAPD. And so we had already been engaged in those kinds of conversations. What has evolved now in the last year or so is, again, going back to this work that we're doing with LA County with response to those in mental health crisis. We also have deployed a collaboration with the D.D. Hirsch Foundation for suicide, those that are, under duress and threatened to commit suicide. And so we're providing those redirected calls to those efforts. But again, we are still in the process. I want to be fully transparent, fully in the process still of inking the deal for those therapeutic mental health bans. And that's something, well, again, because we're still in kind of those conversations around the money. And that's our biggest challenge, is holding some of the other governmental agencies accountable to funding their part of what we need in terms of these responses. In absence of these collaborations, we've always deployed, unfortunately, for both them and for those that are calling seeking help, members of law enforcement to do what they have not been trained to do. And so we have to be honest about how we've all been rather complicit in sustaining a model that hasn't really addressed the root causes of what the problems are or what individuals need. And so, transitioning those off is, as you all know, and as we're all experiencing, it's the balance and struggle between meeting with labor partners, getting their sign off and getting their cooperation so that we can get all these new units online. And so let's all have that real conversation about the dynamics and how difficult that can be when we're having these conversations. But that said, I'm glad that we're seeing the progress and the momentum being built to offlining the work that has become traditionally the responsibility of some of these members, whether it's law enforcement or even the fire department, to now migrating to the appropriate mental health or social service providers that should be responding to these calls. That said, I want to just also indicate one of the other efforts that I think is really important that we should all be talking about, and it's just another leg of the stool that we need to be talking about, and that's some of the investments that are commensurate with the investments that we make in law enforcement or any other first responder model, is that we have to be talking about what are the root causes of what's driving many of these calls. And I know many others, Mayor Engen, you mentioned it. It's about, for us, when we talk about in the last 10 years, 1.2 million calls for arrest being associated with young people in the ages of 10 to 25, 32% of arrests represent that age group. And so we need to have a complete paradigm shift in the city of Los Angeles. And so one of the other areas that we're working on is creating a youth development department that provides those early diversion and intervention programs so that we don't start identifying them in crisis when they're too late, when it's too late. And so that's just another part of this conversation that we're also engaged in the city of Los Angeles, because we don't invest substantially in those efforts. We do have early intervention and prevention models that we do, but it ages out for youth at the age of 15 and a half. And so if we don't have a comprehensive programming effort that we don't just say is the responsibility of another level of government, then we're failing the youth of our city and still putting them in a circumstance where likely they will engage or have an entanglement with law enforcement that, you know, we could have captured earlier.
Thank you for sharing that. And Mayor Engen, I'm hoping you can also shed light on some of the partners that you all are working with in Missoula as well to give folks a sense of that landscape.
Absolutely. Pardon me. And Daniela, please hit a timer anytime because I tend to go on. It's likely a occupational hazard of mayoring. I think some additional context and both council members Rodriguez and Gautier, I think, would agree there has been a long-term abdication on the part of federal and state governments to deal with some of these issues. And so more and more I've discovered over the course of my 16 years of service as mayor here in Missoula that we're left to pick up the pieces, and we're really building infrastructure that once existed at the state and federal level to help people in a wide variety of crises. And building the infrastructure while trying to fund it and invent it simultaneously is tough. So this work is really iterative and really does require that cooperation. And we've been enormously fortunate here in Missoula, which is a city I describe as being near Montana, in the fact that we have a tremendous a spirit of collaboration and innovation, and departments that are very traditional for a wide variety of reasons have really stepped up. In particular, the Missoula Fire Department. We did a request for proposals to staff our mobile crisis unit, and the proposers were the Missoula Fire Department and our federal health center, Partnership Health Center. They came together to propose a model that would that we could deploy 6 days a week, and it was the winning proposal all day long. The technical expertise is there, the resources are there, and frankly the spirit of collaboration and that fundamental notion around public service, and that we are here to temper suffering and improve lives, lives and breathes in those organizations. So they came together along with a tremendous amount of support from the Missoula Police Department, certainly from my team, and from the Missoula City Council. So we're putting those pieces together. But again, part of this is identifying gaps. So one of the things that we are doing better as a function of mobile crisis is meeting people where they are, but we still have a gap in the system as to where those people go. Traditionally, we do two things. We medicate or incarcerate. And in most of these cases, neither of those approaches are solving any problem, nor are they tempering the suffering of the individual with whom we're trying to work. So we need more crisis beds. We need a space that is somewhere between a home environment that isn't working today, and a state commitment, or an emergency room visit. So we're working on closing that gap with some additional crisis stabilization tools. And as Councilmember Rodriguez suggests, you know, I often tell folks that if each of my residents had a decent place to live, a full belly access to healthcare, and somebody in their life who loved them, we'd be a hell of a lot better off, and I'd be less busy. And those root causes, those fundamental issues, largely around income equality, largely around racial inequity, classism, gender discrimination. The list goes on and on. So we're treating symptoms here largely. And our hope is that as we get better at treating symptoms, we get in the business of taking care of the cure.
Right. Thank you. Councilmember Gautier, did you want to elaborate on some of the partnerships and overall landscape as well?
Yes, although Philadelphia is moving forward to expand the way that we respond to mental health crises, I didn't want to skip over the fact that we have an existing system. So Philadelphians experiencing a mental health crisis currently cannot always get the on-site treatment or access to resources in the way that they need it, but we do have resources available. A person seeking mental health services can call the Philadelphia Crisis Line for assistance. Also, the Department of Behavioral Health currently operates an adult emergency mobile crisis team and 3 children's mobile crisis teams to provide on-site assessment and intervention when people need help. This is highly sought after, service. In 2019, the adult mobile crisis team was dispatched 2,276 times, and the children mobile crisis teams were dispatched 846 times. And the demand for these services currently outpaces the supply. We also have 5 crisis response centers citywide. The centers operate 24/7, but they're not always easily accessible to people, especially in a crisis situation. But the current centers conduct approximately 12,000 evaluations annually. So we have a current system, but without that system being more comprehensive and more easily accessible, people in distress are forced to call 911, which presents a level of danger, especially to people in Black and Brown communities. And so that's why we're moving forward with expanding the co-responder program that we have, and with developing a peer specialist program. I will say that as a city, we're very committed and have moved further along with the co-responder program. And we should have our 4 teams up and running by this spring. There are many in the medical community that would like to see us develop more of a civilian response and to give that pilot legs, so that we would have the ability to have clinicians show up when people need help and not have armed officers. So we're hoping to get both types of models up and running and to be able to measure the impacts on people in our city who need help and assistance.
Thank you so much. And I'm wondering if anyone could speak to the process of deciding which calls alternative teams would respond to, and to what extent that process involved other partners outside the city, whether it's community members or the contracted providers.
So, as I understand in Philly, the call script is very, very important to determining this. So as calls come in, the folks in the call center would be able to determine exactly what's happening, exactly what the level of gravity and danger is, and then the calls would be routed towards a co-responder unit or a mobile crisis or alternative response unit. There are also calls that will, or not calls, but officers in the street will also be able to assess through their training what's going on in a particular situation and be able to route, a response that way. I think we're still working out some of the particulars about which calls are most appropriate for which response, but that's my basic understanding of how it's going to work.
It's similar to my colleague in Philly, where it's largely scripted through 911. And again, it's an iterative process. One of the things that we're discovering is that is that that process needs to be adjusted a bit. And in some cases, despite the fact that we have these mobile response units, what I will tell you is that there is also often a law enforcement co-response because of the nature of the call and for the safety of the mobile crisis unit. Those folks are continuing to try to dial in what the factors are that can really sort of call off that initial law enforcement co-response, because certainly anyone who's experienced trauma associated with law enforcement is going to get ratcheted up considerably when they see a squad car show up. But it is a process, and we continue to consult with mental health professionals, our friends at our medical centers, and Partnership Health Center has clinicians who are also informing the process. But it is far from perfect.
Thank you for sharing that. And you know, in various ways, you've each spoken to some challenges, whether it's decision making around funding, whether it's working with the resources that you have to provide different responses sooner, even though there may be a preference for mobile crisis teams, as you mentioned, Councilmember Gautier. I'm wondering if anyone would like to put maybe a finer point on a challenge around developing these responses that you haven't yet shared, or reiterate something that you have.
I wanted to add one more thing that I think is really important that Philly is doing. We're developing a script for family members too, so that they can also help the call takers to understand exactly what's going on and to better route these calls for a response. So that script will be available online, but also the city is going to work really hard to get it into the hands of trusted community groups and community members.
So with regard to that question, Danielle, I think one of the interesting twists here is that as we considered mobile response, among the things I heard from police officers, all of whom in our department will have been certified in crisis intervention, the crisis intervention model by the end of the year, is that many of these officers consider themselves actually pretty good at meeting people where they are and providing some of that, while not clinical, certainly teetering on the edge of social work response. And they take seriously the opportunity to try to find an alternative to that emergency room or the detention facility. And so they were a little bit worried that they wouldn't get to do some of that work because it's important and meaningful to them. And they feel as if they're helping people. And in some cases, I think when you're a cop, you don't often feel that way. So that was an interesting response. So we're not eliminating the notion that our officers can provide assistance, and they will need to continue to provide that assistance. You know, we take about 60,000 calls for service a year, and we're servicing through the mobile unit something on the order of 25 a week. So we've got a long way to go, and there remains a huge gap. So I want those officers to be in a position to provide assistance as well.
Yeah, and just going back to what pushback, and I kind of made small reference to it earlier, is, for example, the concerns of where these mental health unit vans and the staffing would be deployed from. That was actually a question that was raised by and concerns by labor partners who felt, you know, they were concerned with the environment of a firehouse, for example, being compromised by civilian staff that were not sworn personnel being co-located in the firehouse. And my response to those individuals was, well, the longer we continue to do their work for them and not gain those resources, the longer we defer raises or other opportunities to fund the work that you should be doing, that it serves as your primary function. But that is, you know, it's about sharing the responsibility to deploy the right resources and getting everybody aligned to that. And, you know, that does require very difficult conversations. But I think it warrants us having those difficult conversations to say, guys, you know, we're not growing any more money on these trees. So if you want to be able to sustain resources in the manner to which you become a customer, we want to grow it. We're unable to do it if we continue to provide the service gap where other agencies are falling short. And in our circumstance, it's namely the county. County oversees mental health. You know, Mayor, you mentioned it earlier in terms of we continue, what we're talking about, folks, and when we talk about alternative models and deployments is, again, we're still talking about suppressing what is systemically wrong. And we still have to work on getting to what those root causes are and holding those other agencies, whether it's our state, federal partners, or county partners, accountable to doing their work. We have, you know, systemically changed a lot of issues that we are finding in our streets, and we aren't getting the resources commensurate to address those problems or support individuals where they need it. And so I think, you know, it's, again, and I know we haven't talked about this, and I know this is something we're all committed to and working on it, but we also haven't talked about the reforms that we all need to continue to deploy in accountability. And I think that's still, you know, we can't have these other conversations in absence of still pursuing the reforms that are necessary to have full accountability of individuals who act egregiously and not in line with their sworn roles as peace officers or any government service.
Well, I really appreciate that comment, Councilmember, because I wanted to ask you each, in what ways is the work that we're talking about today part of a broader plan or effort to reimagine public safety? So we're talking about one specific topic or dimension, and the panel following us is as well, but we want to see it in a broader context in the work that you're doing in your communities. So would love to hear about that.
Well, I'm sorry, Councilmember, please.
Well, I mean, I can start. I will tell you that, you know, sadly, after the insurrection, I've been, you know, making inquiries about investigations on any member of law enforcement that was involved. They don't belong in law enforcement. You know, we have circumstances where I'm trying now I've introduced several motions to begin investigations utilizing the support of our district attorney to do investigations for whistleblowers to protect them on cases where, you know, we need cultural changes in these departments, and the silence is making them complicit because of the bullying that ensues if people speak out against things that they see. And so I'm actually investigating methods of taking it out of the department for investigations on whistleblower complaints as an example, as a means for us to have more protection for individuals to be able to preserve their anonymity when they see something wrong that still enables them to speak out. And I think those are some of the things that we have to talk about, because, you know, it still comes down to, you know, obviously it is not I think there are ways that we can systemically change these things and root out individuals that do not belong in law enforcement. But I think we have to do so by protecting people in their need to speak out when they see it, and giving them the protection. And I think that's really important.
Thank you. Mayor Engen, did you want to share as well?
Yeah, you know, we all operate at scale, right? So certainly the city of Missoula doesn't operate at the numbers that the city of Los Angeles does, but problems don't recognize population necessarily in some cases. And I've had some experience with law enforcement reform. We operated for 5 years under an agreement with the United States Department of Justice after an investigation that would have led to a consent decree saying that the city of Missoula had engaged in policy and practice of discriminating against women in cases of sexual assault. I didn't want to go to court because I wanted us to get better. And through that process, we did. We reformed our interview techniques, we reformed our training, we reformed our processes in working with partners, particularly at the county attorney's office, our district attorney in effect, to ensure that victims of sexual assault were A, being believed, B, that we were appropriately investigating those cases and bringing those perpetrators, when appropriate, to justice. And that was a painful process. Police officers are proud. And I actually, at that time, my chief did not agree with my decision to enter into an agreement, but it was the right thing to do. And so it can be done. We also learned the hard lesson that that background checks are important. You don't have to investigate an officer necessarily if you don't hire a bad apple in the first place. So our hiring processes are really rigorous, and anymore we don't hire a police officer until we've gone to the location wherever they happen to have served previously, done extensive interviews in addition to all the background check and psych work. And then we've got a year-long training and probationary period, and there are folks who just don't make it. And that's really significant. There is a culture that we have tried to build at the city of Missoula, and it really is a service culture in law enforcement. It's a peace officer culture in law enforcement. It is imperfect and always can stand to improve, but those improvements are absolutely doable. And I think there's maybe some skepticism around that, but you can move mountains with the right leadership.
Thank you for sharing those specific examples. Councilmember Gautier, I'm going to give you the last word before we pass it over to our partners around how this gets into broader landscape for reimagining public safety.
Thank you so much. For me, this conversation around alternative mental health response is a very tangible manifestation of how we can reimagine public safety, and also a very tangible and non-controversial example of what it means to potentially defund police and invest in other things, right? Communities need more than just police. They need a myriad of things to be safe and to thrive, including access to mental health resources and safe, affordable housing and good schools and recreation, all those things, right? In Philadelphia, no one was made safer on October the 26th by having police respond to the 6100 block of Locust. Nobody. And so this is a pretty politically friendly, non-controversial way to figure out how people who need access to mental health services can get them. And I'm glad that we're looking at expansion of the co-responder model, and we're so far down the road, but I also want us to really seriously take into account how we can have a better and more comprehensive civilian response as well, because I think that clinically trained civilians already know how to de-escalate, right? And I think many of our communities need that kind of loving, empathetic response. So for me, it starts with this conversation around a mental health response, but I'd love to see it grow to all of the things that get to the root causes of making our communities safe and whole and healthy.
Thank you each. Thank you so much for sharing all the work that you're doing, all the opportunities and challenges that you've identified so far, and the call to action around activating other partners and pursuing greater attention to some of the root causes that you mentioned, and being in it for the long haul. So thank you very much. And I'll pass it over to Anthony Smith from Cities United to lead our next segment.
Thank you. Good afternoon, everybody. Hope everybody's doing well. As stated, my name is Anthony Smith, and I'm the Executive Director for Cities United. Cities United is the network of cities, community members, and mayors across the country really helping them redefine what public safety is and really create strategies to create safe, healthy, and hopeful communities. Our ultimate goal is reducing the homicide rate of young Black men and boys in half by the year 2025. And we've been at this work for the last 10 years. So it's an exciting time for us to be thinking about how we keep our kids alive and how we keep them safe and how we keep them healthy. And it's a time like this that we do need to stop and reimagine what public safety really is. And as we reimagine and redefine it, how we reallocate our resources to support the things that we know that really keep our families safe, healthy, and hopeful. So I'm excited to have this conversation today with Councilmember Fontinato Bass from Oakland, and then also Councilmember Louis George from DC. Both cities are doing some amazing work and on the front line and cutting edge leading the work. If you think about Oakland, Oakland has been, there's a number of reports that you can find on the work that Oakland has done. One that came out by Giffords that talked about a case study for hope. And it actually outlines the work that has happened in Oakland for the last 10 years that had led to reductions. And, we want to talk bigger than reduction. This really is about saving lives and creating space for kids to thrive and live out their dreams. But also Oakland was one of the first cities to actually implement and hire their first chief of violence prevention, which I think it is an amazing thing. And to watch that, I think he's been in his position for 2 years and is moving in that direction and really helping to guide their work and shape their work. But also have a task force, reimagining public safety, that we'll talk a little bit more about what that is and what it looks like. They've been up and running, I think, since July of 2020. So I've been having this conversation and thinking through. Then if you think about what's going on in DC with Council Member Louis George and the other folks there, DC last week just actually announced a new office that we're excited to learn more about. Really taking resources and energy around this office, created a director for violence prevention that's pulling two departments together to really focus in on how do we really do this work, and how do we do this work not just with the right capacity of people, but also with the right capacity of our resources. I know the mayor also set aside $15 million more to support that work, and we'll probably be watching it as it grows to figure out what all we can do around that work. So there's a lot happening in both of these cities, and both for the council members, I'm sure, are heavily involved and have a lot of conversation to go with what I stated, but also how they're leaning in and building into the work. And I'm gonna start with Councilmember Louis George, really around what are local conditions and needs to really prompt you all to adapt these new strategies, or to prompt you to think about and really highlight this work and focus in on this work. And thanks for being with us.
Yeah, thank you. Thank you so much. I think, when we talk about the local conditions that brought about this, unfortunately, a lot of what occurred here in the district is that we just saw some of the highest rates of gun homicides, here in the country. And we had more than 920 residents who were shot, and at least 170 of those residents were killed with guns, contributing basically to the highest homicide rate we've had in over 15 years. And gun violence is the leading cause for us here in the district for young people ages 15 to 24. And so really, what we realized is some people wanted to really double down on the decades of failed public safety policies that really have led to mass incarceration of mostly Black and brown residents here in the district, but they weren't stopping the rise in violent crime, right? And so what conditions led to this is we said, we can't do the same old thing and then expect a different result. So what can we do differently? And we had the ability to do that because within our political landscape, right? I'm a former assistant attorney general, but our assistant attorney general, Carl Racine, who was able to come in, who's a former public defender as well, was able to come in and really reform the way we looked at public safety here in our community, and started programs that predated some of the programming we had come out of our NEAR Act, which actually collected data to show that other models can work. So one of the programs we collected data on was our Alternatives to Court Experience program, diversion program. And we partner with the Court Social Services, Department of Behavioral Health. And instead of, when young people were coming into the system, instead of, prosecuting those cases were diverted to our diversion program. But it helped not only the young people, but we got families. So we connected them with housing, right? We had someone connect families to ensure housing. We appointed education attorneys to update individualized education plans for young people. We started to help connect some of their families with jobs in the city, right? And so what we found in that was that 83% of the young people who went through our ACE diversion program actually never came back to the criminal justice system, never came back in as a juvenile to our system. And so we were able to show that if you address the underlying causes, right, housing, education, health needs, right, some of our young people had asthma, conditions that that weren't being addressed adequately. When you address those underlying issues, you get results, right? And so because we had an attorney general who was willing to put in that front end work and collect some of the data, that data actually, drove a lot of our, people who were like, oh, this won't work, to believing now in a system that does work. And so that prompted many of our leaders to say, well, let's try this alternative route. Let's redefine public safety, and let's start addressing the root causes and interrupting violence before it occurs. And so that's really, how it prompted that. And then many of our city leaders who at first were not convinced, actually came over and started to be on the side of collecting more data. And we passed something called 2016, we passed the NEAR Act, which was a legislation that the council passed to implement public health approaches to prevent violence and reduce incarceration. Well, within the NEAR Act, that was another data source. One, it created our Office of Neighborhood Safety and Engagement, who was going to focus literally on interrupting crime in our communities. And that's where our Cure Violence Interrupters program and many of our programs are based out of the Office of Neighborhood Safety Engagement. But the other thing it did was started to collect data. And some of the data that it collected was on like stop and frisk data, right? Where we saw majority Black residents being stopped and frisked and them not resulting in guns being collected, right? And so it started to call into question even further how we were handling policing in the community. And so I think, one of the things, the landscape was one, obviously having leadership who wanted to go in a new direction, but having the data to prove that direction was fruitful for us as a community.
I forget I muted myself. Councilman Fontenelle Bass, the same question. What was the conditions like in Oakland, and what made you all really lean into this work and really decide it was a new day that we needed to move towards?
Thank you, Anthony, for the question and for having me. Prior to joining the Oakland City Council 3 years ago, I spent the past couple decades as a community organizer. And so it's with that experience that I come into the work and really want to sort of start off this conversation reminding us about what it means to have deep community participation and engagement in violence prevention and saving lives. And I think it's already been touched upon, but I think it's important for this conversation to ground ourselves in the fact that community engagement and participation leads to having the community define the problem as well as define and implement the solution. And that, I think, is what's really valuable as we do work to interrupt violence and to prevent violence and focus on the root causes. And for Oakland, our history in terms of creating a program to address violence prevention dates back a couple decades. It was in 2004 that we had our first measure around violence prevention that was passed by the voters and created a funding mechanism that would work to reduce homicides and improve police and fire response, but also importantly, to intervene and prevent violence. And that program, as I said, has been running since the 2004 measure was implemented. There was another update of that measure in 2014. And that program, which was formerly called Oakland Unite, has been creating a lot of the things that I think we're going to talk about over the next half hour. So I won't go into that and stay on the question in terms of the political conditions. So it really was a combination of triple-digit homicides. You know, Oakland is a mid-sized city with over 400,000 residents. And for us, when our homicide rate has been above 100 or 110 or 120, it's incredibly alarming. So it's been a response to violence, particularly in our Black communities, in our Latinx, and other communities of color, as well as really trying to center healing and taking care of people who've been through so much trauma and preventing and intervening in violence. And just to fast forward, like so many cities who were engaged in this reimagining process, for Oakland, it was this national awakening, or reawakening, I should say, because of the murder of George Floyd. But for Oakland, there's a long, long history around these issues of police accountability, around really focusing on the root causes of violence. And there was already an Oakland Defund coalition that had been going for 5 years. And so the summer was really incredible engagement by our community with the national, the national reawakening around how do we really focus on saving lives, and do that in a way, as people have been talking about, that understands safety isn't served equitably in all of our neighborhoods. You know, we have this tension, which I'm sure many of you have, in terms of communities feeling both over-policed as well as underserved. And we know that we need to improve safety, not only in decreasing crime, but really increasing our ability to heal our communities who are so impacted by trauma, and really reduce those interactions with communities of color, with police, that could escalate into harm and further the school to prison pipeline. So in Oakland, so much of that came alive in the summer of last year, and was also compounded by the fact that under my 2 years in office, we've had 3 police chiefs, and many, many police chiefs, if you know Oakland, over the course of the 18 years we've been under a negotiated settlement agreement, which we're still trying to get out of. We have a police commission that's independent, but has been struggling to get the resources and authority it needs. And we had to put a measure on the ballot to make sure that we had those resources, as well as an independent inspector general. So the conditions were similar to many other cities, but unique to Oakland. Really intense violence, especially in communities of color, a long history that we're trying to really struggle with and get in front of, in terms of addressing greater police accountability and trust in our communities.
Yeah. Thank you for that, Council President. I want to follow up with you on this idea of centering community in the work, and how is Oakland doing that through all phases? And as you think about that, and if you could, I also think that healing piece is very important. And so just if you could talk a little bit about how you all center community members in all phases, but then also what does the healing port look like?
Sure. So like I said, we've had a program called Oakland Unite, which has been our violence prevention program for a couple decades. In 2017, the council passed a resolution to create our Department of Violence Prevention. And Chief Guillermo Cespedes, who is our DVP chief, he actually was hired last year, and it's this year that we're undergoing the formal creation of that department and transitioning all of those programs under the Department of Violence Prevention. So building off many decades of work, the mission of our department is to reduce violence and also to engage with communities that are dealing with trauma. And we have teams of direct service frontline staff who are really right there whenever there is an incidence of violence. They're there real time. So we have staff who are responding immediately to violent situations and providing trauma-informed support. They are engaging with family members and providing support. They are providing life coaching or mentorship with people who were impacted by violence. And that could be a range of things from the mentorship, as I said, to services like employment or transitional housing or legal advocacy. So there's really sort of this robust network that we have that includes staff who are part of the city of Oakland, who are sort of at the front line and able to respond as violence interrupters, life coaches, community ambassadors, gender-based violence specialists, combined with law enforcement and outside social service organizations who provide additional support. And we experimented last year with a pilot program that partnered with community-based organizations that really centered healing. That's something that is a very active conversation here in Oakland because it was a pilot, and there's been so much value because there's so much sort of generational trauma with Black and Brown communities here in Oakland, and being able to focus on healing that trauma, supporting families, understanding when and where violence occurs so that folks can be there to support, but also very importantly, do the prevention piece. And that means reducing recidivism and further participation in the criminal legal system, which a lot of these programs have been able to do.
No, thank you for that. Let me go over to Council Member Louis George for this. How are you all in DC and you and your work making sure community members are centered in this work as well?
Yeah, absolutely. I will say, recently, when George Floyd occurred and a number of advocates were justifiably really angry at kind of how much work we had not done despite having legislations in place. One of the things that came about was creating, a task force. And I will be honest with you, I was a little apprehensive on task force because in the past, councils will, groups will create a task force sort of as a performative action. And so we were very clear that, we welcome a task force. And so we did put together a task force, but what we did was make sure that task force had grassroots leaders who have been working on this, working on work here in the district for over a decade. So you had, the Defund Police Coalition as a part of on that task force. One group in particular, our Swan Academy, is our young people. It's a nonprofit that empower our young youth to do civic leadership and engagement. And they were really, the Black Swan Academy was advocating for police-free schools and really talking about, why don't police officers see Black children as children, but see white children as children, but Black children are seen as adults, right? And so the Black Swan Academy became a part of this of the coalition as well. And then we partner with some of our universities, our Georgetown University, our Juvenile Justice Clinic, their policy director who worked on it was able to be a part of in censoring that work. And so, we not only came up, we had a homicide elimination task force as well as a task force, a community police working group dedicated to doing that work. And it was important for us to make sure that the individuals who, were being centered in that work. I think the other thing that we did was it was who we were putting in different positions, right? And so in addition to putting grassroots members on our task force and doing the work, we were able to create a new position, right? And that was the Director of Gun Violence Prevention. And that came out of the task force actually recommendations. Because what we found is we had all these agencies, but they weren't sharing information. So we had the Office of Neighborhood Safety Engagement, and then we had the Attorney General's office doing work, and then Department of Behavioral Health. And so what we found here in the district is that a number of our agencies were doing work, but they weren't sharing data across the group. And so even from our medical examiner offices as well, right? And so this person is actually dedicated to making sure that we're sharing data and sharing information, and also that every single agency in the district is committed to a homicide reduction strategy, right? And so that means, as far as even Department of Parks and Recreation, what are you doing to prevent homicides in our district, right? Every agency then has a role in making that happen. The other thing that I thought was really critical is we also recently also passed legislation to create a racial equity office within the council, within the district council. So now every legislation that comes before the DC council has to be measured in terms of racial equity. And so every legislation now gets a racial equity impact to it. And so that also, adds to now how we even create legislation and measuring it from a racial equity standpoint. And so all of those things really, I think, work together. And I want to say one unique thing about the district, which we say all the time, but it's very true, is that we don't have statehood. And so we, and statehood impacts us in very serious ways, because most of our offenses are actually prosecuted by the U.S. Attorney's Office. And whoever is the head of the U.S. Attorney's Office that happens to be appointed by the President of the United States, you can imagine the last 4 years, what that looks like for us as a district, right? And so some of the work that we couldn't do in a traditional, if we had a district attorney, we weren't able to do. And so that's why we had to be even more focused on an outside strategy that did not include, it was focused on crime reduction as well. And we even, I think one of the things how we centered our community as well, and specifically young people, is one of the things we did was take away, we had legislation that we passed on reducing the amount of times young people are suspended from grade, from pre-K through 8th grade and through high school. We put a ban on the amount of suspensions and the type of offenses that could be suspended, right? We talk about ending the school to prison pipeline. Those are the ways you do it, right? Suspension is one avenue that absolutely replicates and creates more of that school to prison pipeline. And so by changing that method, we actually got young people in some of our schools had restorative justice programs within their schools, where the young people were a part of facilitating the restorative justice work within their schools surrounding suspension and the work they do. On top of the restorative justice program, here in the district, we had the first restorative justice program out of a traditional prosecutor's office. Our restorative justice program actually was done with Seema Gujwani, who came in and created a program that was the first of its kind to address reduced crime in our community, and was actually we saw real rewards of rehabilitation. And so, those are some of the ways that we've been centering a community. But I have to say, specifically the young people we've been able to center, and the advocacy they've been able to do on their own has been really impactful, as they talked about police-free schools, in which we removed, as a result of the young people's advocacy, the contract that was with our Metropolitan Police Department was removed for school police officers, was removed from the Metropolitan Police Department, and now is housed under our DC Schools Department. A change that came out of the advocacy of our young people recommending that work to the council.
No, thank you for that. That was really in depth, and young people change everything. So we got to get into them, and listen, watch them push. Council President, when you think about the work that's been done, and we all know it's time, but what are some of the barriers that you're running into in Oakland that is kind of preventing or hindering the work from moving forward?
That's an excellent question, Anthony. I think there are a number of challenges that we're working to overcome. Like other cities across the country, we are experiencing an increase in violence, and that's specifically shootings and homicides. This time period is like no other in terms of the pandemic and the recession. I mean, people's everyday lives have been so disrupted. So here we are, And I do want to just say quickly that we also have a youth advisory board for the Reimagining Public Safety Task Force that I'm co-chairing. I just wanted to mention that because they've done a tremendous job creating the board and engaging young people. So just wanted to lift that up. But in terms of challenges, we are toggling between understanding that the system, the public safety system, is not working for everyone, while we're also dealing with increased violence. And on top of that, dealing with a budget shortfall. And you know, it's challenging, I think, for all of us as elected officials to kind of align our various branches of government. I mean, I'm on the council, and we have to work with the mayor's office and the city administrator who reports to the mayor, as well as the county, the state, the feds. And so I thought that Mayor Engen made a really good point when he said the federal government has abdicated its responsibility. I mean, we as cities are dealing with decades of disinvestment in our social safety net. And that leaves us in a really challenging position where, you know, I believe the root causes to violence and crime and poverty are lack of access to jobs, to stable, safe housing, to quality education and quality healthcare. And that is happening systemically at every level. And so here we are trying to meet our constituents' daily needs to feel safe and to actually be safe. And there, you know, there are these structural issues in terms of what the disinvestment has been at every level that we are really trying to be as creative and resourceful about to fund. I think one of the ways that I'm trying to address that in Oakland is reminding people that, you know, in the San Francisco Bay Area, we live in one of the wealthiest regions in the entire world. And so I'm working to update our corporate business tax to make it more progressive because it's a flat tax right now. You might be a grocer, a mom and pop grocer, paying the same rate as, say, Target. So we have to really address this mission of fear and scarcity in our communities right now with one of love and abundance, I think. You know, I think those are some of the real challenges. And I think there's also just a real challenge, which as a newer elected official that I am really navigating in terms of how our governmental institutions can really push ourselves to be creative and responsive because there's so much inertia in terms of how the system already functions. We're trying to stand up a mental health program, and it's been several years just to get a pilot off the ground. And so to hear you all talk about how you've done your pilots, you're up and running, it's so inspiring. So I think we also need help in terms of how can we be more responsive and resilient and creative during these times, because our communities really need that.
Yeah, and I appreciate that. My internet went down for a hot second, so I came back in. So I really do. And I think when you were talking about, I think one of the things we saw in Philadelphia, the controller actually put out a report, and I'm sure the council member from there saw it, is that it talked about this investment and prevention and institute, what the return of it is, not just saving lives, but how much more resources you would have. So as we continue to build this out, and you know, that barrier that you talked about, the scarcity model, is how do we help people see that this early investment, what the return would be, not just on saving kids' lives, but what would it really be for us as a city and as a country of all the resources we would have because we're spending it in the right way and we're giving folks opportunities. So same question for DC council member. What are some of the barriers you're facing and challenges that you're running into as you guys continue to reimagine public safety?
Yeah, so much of what the council president said is so true. This idea of fear and scarcity, right? I talked a little bit about what our homicide rates are looking like here in the district, some of the highest in 15 years. And so, you know, out of fear, some individuals will easily go back to the old models of being like, no, we need more police. That's the answer. That's how we solve this. And we'll use those examples of like, you know, of how these things don't work, right? They're like, oh, well, where are violence interrupters? You know, they didn't interrupt this, although not realizing that oftentimes police are in the area where crimes are happening. And so the police are not preventing crime from happening, but they're being responsive to it. And so when we get to prevention, that's a different conversation. But it's so easy for people to go back to that same notion that more police equals safety for some reason. So definitely coming up against that. What are we up against? The pandemic. I cannot say enough how the pandemic has greatly impacted our ability. We have a number of Cure Violence Interrupters teams who, are based in the Cure model, which means, they are our violence interrupters, are credible messengers who have been in the community, who have community ties and community roots. Well, during the pandemic, they haven't been able to do their usual violence interruption work, which usually they would literally, be going door to door, talking to neighbors, able to actually be a part of the community. And so that has been a significant barrier for us as our violence interrupters teams throughout our communities have had to figure out how can they, still connect with community members and still do the work they need to do to interrupt crime. And so I can't say enough how the pandemic has impacted that. I have to say this, but, I think the police union is a barrier to doing some of the work that we need to do here in the district, especially restoring trust as it relates to our police officers here in the district. We had a young man in my district who was recently killed during a police chase that was not, that shouldn't have been occurring. And that police officer obviously is still on the force, although they're on administrative leave. Taxpayers are still giving dollars. And so every time we have these incidents with police officers and increased use of force and things of that nature, there's still no accountability. And so, I always say this, that trust builds community. And so without that trust, our community is still in a place of distrust with the police department, and our union oftentimes is the barrier to that. In addition to that, I talked about how we have to have data. We use data heavily here in the district. And one of those things, when we talked about the NEAR Act, actually requires the police force to report their stop and frisk data. And so they have to include stops, use of force, the outcomes of complaints, robust crime data. Right now, the ACLU here in the district is suing the police department for a second time to retrieve the data that's required under the law. And so, each time they don't comply with the data demands, it costs the city money in lawsuits, but it's data that's critical to the work that we are doing here in our community. And so the need for greater transparency around data and the resistance to comply absolutely it is a barrier for us. I think one of the other things is, as we said, we have, a crisis, an economic crisis of the pandemic. Fortunately for the district, we just, got our report back, and we actually are doing well financially, and we actually have revenue. And so, before I was saying, our budgets are moral documents, and they absolutely are. And so when people say we don't have the money to invest in these programs, it speaks to us as a community. And not only I say, we absolutely have the money to address these issues. And so continuing to make sure we have the funding to implement the NEAR Act is one part that is important for us, and we absolutely have to have across the board from the mayor and buy-in from the entire council that this is where our money should be investing, especially in violence interruption programs, but also in underlying programs. I'm very worried that we have an eviction crisis that's very real, and that when the moratoriums lifts, we're going to see housing become a huge problem. And so when housing and job stability, our numbers as far as Department of Employment Services, our numbers are high as far as unemployment. And it looks like a situation that is going to be ripe when these moratoriums lift, ripe for us seeing the causes and impacts and the impact it's going to have on safety. So getting people to realize now that canceling rent and not lifting utility moratoriums is the way that we absolutely also deter and go into a direction of more crime getting that connection to be seen is also kind of is absolutely a barrier. So those are some of the things that we see as barriers, and we as a community have to and as a council have been working to make sure that we are having continuous oversight and pressure from our elected leaders in our communities to make it happen.
No, thank you for that. And I don't think we can emphasize enough how much of an impact and a barrier COVID has been to this work, and how it has actually impacted this work in ways that we never saw coming. And we got to get our hands and wrap around it. We've got to wrap up real quick. So I think I think we're at time, I believe. So I just want to thank both of you all for your time and commitment and your leadership. And as we think through and as we close, I can only imagine what your visions are for what this would look like if we get it right over the next 5 years. What would our cities look like if we can get this right over the next 5 years? Not just what it'll look like physically, but what would our kids' faces and smiles and hope look like as we move forward? So again, just appreciate you all for your work and your continued support and commitment to reimagining public safety, not just for your city, but for this country. So thank you both.
Thank you.
I'm gonna turn it over to Stacy Richardson to wrap us up and close us out. So thank you all.
Great. Thank you so much, Anthony. And thank you, Council President and Council Member, for your leadership and sharing your thoughts. It was such an insightful conversation. So we really appreciate you all being here today. This is the first of what will be many listening sessions associated with the Reimagining Public Safety Task Force here at NLC. I want to thank our co-chairs, Mayor Holt and Mayor Baraka, and of course, all the task force members who participated today. Also, a big thank you to Daniela and Anthony for our partnership with the Vera Institute and Cities United. Really appreciate you all lending your expertise to this conversation. And of course, I want to make sure that we thank the MacArthur Foundation for their ongoing partnership with NLC. We couldn't do this work without our partners, so thank you. We really hope this starts a dialogue with each of you and maybe sparks a question or a creativity or something you're inquisitive about in your own communities. But we're here at NLC, we believe that innovation and transformation are starting at the local level, and as cities are reshaping the meaning of public safety and how it impacts their residents, particularly their residents, that are Black, Indigenous, people of color who have been disproportionately impacted by this system. There's great work happening, to use community and co-responder models to deal with residents that are in crisis. It's so needed, and we are really appreciative for the task force members coming forward today and sharing their equity-driven solutions and leading these conversations. So we look forward to this continued dialogue, amplifying local action and hearing from all members of the task force really soon. So Mayor Holt, I don't know if you want to add any additional closing thoughts. Nope, we're good. Okay, great. Well, thank you all so much for joining us, and we look forward to future conversations. Bye-bye.